Welcome to Facts TV News, where everything is true. Cop killed in Central Village. A police officer was shot and killed by unknown assailants in Central Village, St. Catherine on Wednesday morning. He has been identified as Corporal Delvin Jackson of a Glendoff address in the parish. The Constable Communication Unit confirmed the policeman's death but was not able to immediately provide more details. "We don't have any information to disseminate as yet," a CCU representative reported. Reports are that Jackson had gone to purchase a motor car before he was killed. Another body found where a cop was reportedly killed in Central Village. Reports are emerging from Central Village in St. Catherine that the body of another man was found close to where a police corporal was found dead on Wednesday. Police sources are reporting that the second body is believed to be of the driver who had traveled to the community to conduct business with the Corporal Delvin Jackson. Further investigation into the shooting is ongoing. Vendors protest Melrose Yam Park closure. Vendors at Melrose Yam Park are demanding that the Manchester Municipal Corporation move swiftly to address the concerns outlined by the local health department, which ordered the facility closed. The placard bearing vendors yesterday attempted to block Melrose bypass in protest against what they said was the sudden action of the municipal corporation. The park, which has 10 stalls, was on Monday ordered closed following an assessment by health inspectors last Friday. 44 more beds for Savannah Larmar Hospital. There will soon be a 30-bed field hospital available for those seeking treatment at the Savannah Larmar Hospital in Westmoreland, where nurses yesterday very vocally spoke about the strain they and the facility are undergoing from COVID-19 cases. Another 14 beds will be added after an area of the hospital is transformed into an additional isolation center. Meanwhile, the Western Regional Health Authority has described as a misunderstanding the circumstances that led to Tuesday's walkout by staff from the accident and emergency ward. Plans were already in place to put a field hospital at the Savannah Larmar Public Hospital in Westmoreland, and coincidentally, the tents were delivered on Tuesday, stated Eric Clark. The hospital has 32 isolation beds and we have 84 patients as of August 17. It's really about space for bed so that people don't have to be in wheelchairs or lying on chairs, which is a problem which unfortunately happened from time to time. Clark said miscommunication had led to the nurses' protests and called for the facility to be deemed an emergency zone in response to challenges being faced with handling COVID-19 cases. According to Clark, the hospital has been declared an emergency zone from August 12, which meant it would only accept critical cases. As usually happens, when a hospital patient can't exceed its capacity, all non-critical cases are sent to other hospitals. He added that plans are already in motion to rectify many of the issues that were raised by the nurses during Tuesday's standoff. Efforts are underway, he said, to hire additional staff pending approval by the Health Ministry to fix the malfunctioning air conditioning unit and provide much-needed equipment. He also pointed to the alarming numbers as the novel coronavirus continues to ravage the parish and the challenges with overcoming vaccine hesitancy. Westmoreland is the parish most affected within the region by COVID-19, Clark stated. The death rate between the 8th and 15th of this month were 29 COVID-19 related deaths. He added that Westmoreland is the least vaccinated parish, a little below the 10% seen in other areas. Last Sunday, we had 76 patients at Savannah Larmar Public Hospital in serious or critical condition, Clark explained. 75 of those patients had not received any COVID vaccine, and one patient has received only one vaccine, so what we are seeing is the unvaccinated ones in the serious to critical conditions. So, I really want to appeal to everybody, if you have been sitting on the fence and thinking about taking the vaccine, please go and get your vaccine. The vaccine drive continues daily, based across the region. No appointment is required. Jamaica records 19 more COVID-19 deaths, 289 new COVID cases. Jamaica recorded 289 new COVID-19 cases and 19 deaths on Tuesday, bringing the infection total to 59,377 and a virus death toll to 1,339. The Ministry of Health and Wellness reported that the new cases comprised of 179 females and 110 males with ages ranging from 6 months to 94 years. The cases were recorded in Westmoreland 83, Kingston and St. Andrew 80, St. Catherine 34, St. James 31, St. Anne 13, Manchester 12, Trelawney 11, Portland 8, St. Elizabeth 7, Hanover 6. The latest deceased comprised of a 57-year-old male from Westmoreland, a 66-year-old male from Westmoreland, a 50-year-old male from Westmoreland, a 75-year-old male from Westmoreland, a 47-year-old female from Westmoreland, a 64-year-old female from Westmoreland, a 65-year-old female from Westmoreland, a 67-year-old female from St. Anne, a 94-year-old female from St. Anne, an 83-year-old male from St. Anne, a 77-year-old male from St. Catherine, a 77-year-old female from St. Catherine, a 52-year-old female from St. Catherine, a 58-year-old male from St. Catherine, a 44-year-old male from St. Elizabeth, a 65-year-old female from St. Elizabeth, a 58-year-old female from St. James, a 39-year-old male from Kingston and St. Andrew, and a 63-year-old female from Hanover. Jamaica has recorded 10,095 active cases after 30 people recovered from the virus, bringing the total number of recoveries to 47,570. Currently, 494 people are hospitalized, 32 of which are critically ill, while 111 are moderately ill. Increase in numbers of genuine fire calls in Jamaica. The Jamaica Fire Brigade, JFB, received a total of 10,209 genuine fire calls from 2020, which is an increase of 131 relative to the previous years, according to the Planning Institute of Jamaica 2020 Economic and Social Survey. The largest number of genuine fire calls occurred in Kingston and St. Andrew, 1,945, followed by St. Catherine, 1,672. Increases were recorded in 7 parishes, with Hanover showing the largest percent change, 96.5%, followed by Westmoreland, 75.8%, and Portland, 50%, the document stated. The survey further noted that a total of 1,796 persons were impacted by fire, 616 fewer than the previous year, representing a 25.5% decrease. The number of deaths decreased from 35 to 31. There was a 48% increase in the number of persons sustaining injuries, while the number rendered homeless fell to 1,676 from 2,317. Civilian adults continue to account for most 71% of the affected population, the document further stated. The survey added that children remained vulnerable to fires, accounting for 3 deaths, 10% of the recorded deaths, and 17 injuries. Meanwhile, the number of non-structural fires increased by 2.3% and accounted for 85.7% of the total fires reported. This increase was influenced largely by the occurrence of Coal King fires, which more than doubled the 21, as well as by a 35.8% increase in the number of farms cultivated land fires. In contrast, the number of structural fires, 1,117, declined by 5.2%, the document stated. Annual changes in the number of bushfires were assessed against the volume of average annual rainfall, and a strong correlation was observed. The survey pointed out that even though the country experienced wetter conditions, there was an increase in the number of bushfires. It is important to note that rainfall will not spread eventually throughout the year. See section on climate. Bushfires were more prevalent in the parishes of St. Catherine, 1,038, Kingston and St. Andrew, 684, and Manchester, 661, which experienced drier conditions as indicated by drought index from the Meteorological Service of Jamaica, the document stated. Please remember to subscribe, like, share, and click the notification bell for daily updates.